So Dr. Weng, how long will a facelift last?
How long a facelift lasts really depends how you look at it. For example, if you were a patient and you had an identical twin and you had a facelift today and your twin did not, 10 years from now, you will still look younger than him or her. But if you were somebody who always wanted to look youthful, usually it's at about that 10-year mark, plus or minus a year or two, that you may feel ready to want another surgery.
What does the recovery look like and how much downtime for a facelift?
Typically, it takes about 2 weeks to recover from a facelift. Usually, most of the stitches come out around day 10 or 11. And at that point, most of the bruising and swelling is, if not gone, can be covered by makeup. I ask patients to take it easy, not lift or exercise for the first 2 weeks as well. But by the end of 2 weeks, most patients are able to return to in-person work and start to slowly bring back exercise.
So how much does a facelift cost?
The cost of a facelift can really vary, both within a specific practice and across different doctors. In our office, it can range from $10,000 for a mini facelift to up to $24,000.
A lot of patients want to know if they will look natural or windswept or pulled after a facelift.
When a facelift is done well and with the incisions intentionally hidden and a correct vector is used for lifting, there should not be a windswept look. It should look natural.
So how do I know if I'm too old or too young for a facelift?
I don't think there's an age that's too young or an age that's too old for facelift. It all depends on what your anatomy is showing us. Sometimes younger patients are seeking a facelift because they've had a big dramatic weight loss, and where their face had a lot of volume before looks now sunken, and a facelift may be appropriate. As far as the upper end of age, it's not as important the number as it is how healthy you are, how healthy your heart and lungs are, and your overall general health.
So what's the difference between the different types of facelifts?
So there are many different approaches to facelift. Within our office, we offer a mini facelift, a traditional facelift, and a deep plane facelift. What I would call a mini facelift helps with the jowls a little bit, but not dramatically with the neck, especially with somebody with a heavy neck. A traditional facelift will help with the jowls and smooth extra skin on the neck. A deep plane facelift will help jowls, neck, and also lift up the cheek or the midface. That's, in a nutshell, the basic differences between those three techniques. And if you ask other surgeons, there may be other names for other types of facelifts, but those are the three that we focus on.
Will they need a neck lift also?
Typically, if a patient has excess laxity of skin in their neck, the neck lift is combined in with a facelift.
So what are the risks of a facelift?
Risks with any surgery: there's risk of bleeding, risk of infection. Particularly with a facelift, there's a risk of a post-op hematoma or collection of blood that we need to keep an eye on to prevent. Risk of nerve damage, both with sensory and motor nerves, that with careful technique can be avoided. And risk of scarring. If there's too much tension on the incision, the scars can become more visible. And all the risks that are associated with anesthesia as well.
So what about non-surgical options versus surgical facelift?
So there are numerous non-surgical energy devices that can help to tighten skin, but none of them truly do the lift that surgical result will. For example, in our office, we offer an option called Ultherapy that can be really good for a patient who's not quite ready for a facelift with very early signs of aging, or somebody who's had a facelift and is trying to maintain the longevity of their result. And additionally, you know, if somebody who is not a good candidate for surgery, this might be a good alternative option.